Good morning, good afternoon, good evening, everyone. Welcome. My name is Melanie Burnitz. I am the Interim Executive Vice President for University Life and the Senior Vice President for Columbia Health. And it's my pleasure to welcome you all to this webinar this morning on supporting students in partnership with Columbia Health. I know we've got a large number of folks, parents, families, and students. So hopefully we're going to address many of your questions around health and well-being during the course of this webinar. I am joined by my two wonderful colleagues, Gail Gachalian, who is our Director of Communications. Gail's going to be monitoring our chat, answering some questions as they come in, and certainly helping with the Q&A portion of this. And my other wonderful colleague, Gillian Atkinson, who is our Director of Strategic Engagement and is really involved in ensuring that we create a welcoming environment for our students, so that they can really come to Columbia and get the best out of it. So we will all be partnering together to hopefully share some important information with you and answer your questions today. So with that, I'm going to go ahead and get started, but please do pop questions into the Q&A function as they come up. While we might address them as we go through the chat, we will open it up even more to Q&A at the end of the presentation. So as the questions come up, as I say, just pop them in there and we will get to them shortly. So with that, let me advance my slides here. So I like to start these presentations with this quote, which is a pretty ancient quote, goes back to the physician, to Alexander the Great. But this really resonates with me when I think about why thinking about health for our college students is so vitally important, because when health is absent, wisdom cannot reveal itself, art cannot become manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. So it really speaks to, we know your students are coming to Columbia to learn, to advance that intellectual part, to figure out what's going to come next in life, but they can't be successful in that arena without health. And that's what we at Columbia Health are here to help support. So when we think about our mission and our vision, I've put them up here. The mission really speaks to what we do, why our work is so important. We advance the well-being of the Columbia community and the personal and academic development of our students. That is super important when I think about our work. It's not just about coming to Columbia and being academically successful. For all students who are coming as undergraduates, this is a real critical developmental part of their lives, where it's what we call emerging adulthood. And it's not only about learning how to, succeed in the classroom, but it's learning how to succeed in life. And we feel like we play a vital role in that. And when we think more aspirationally, we really are leading our university efforts to equitably advance well-being for the communities we serve. Our organization is pretty enormous, and we're very proud of that. We offer more than 80 programs, resources, and services and supports. And we're available not only on campus, but globally, as our students aren't always physically present on campus. So our services actually extend to times when our students are home for the summer, be that within the US or across the globe. I know many of you are calling in from across the globe. And we have really diversified our portfolio. So what used to be only services that could be offered in person because of technology and just some of the innovative approaches we have to care, we can offer virtual supports by all of our departments as well. I'm really proud to say we have one of the most robust approaches to student well-being in higher education within the US. We offer a mix of efforts so we can increase knowledge, promote the development and application of skills, and provide direct care and treatment when needing. And we support our students experience acute and urgent needs, but also students experiencing ongoing chronic needs through these robust offerings. And these are delivered by experts whose careers are really focused within the college health world. For example, myself, I've been in college health. I've got to do math for 23 years at this stage, and you'll find many of our staff within Columbia Health have dedicated their careers to the provision of health on university campuses. So they really are experts, and they can focus our students to the resources that are available when needs arise. We are an accredited organization by an accrediting body called AAAHC, and we've regularly been recognized by our peers in the American College Health Association, in NASPA, and other national organizations with awards for our work, which really is exemplary and often is paving the way for other college health programs to do what we do so well. You can see here in this graphic the departments that fall under Columbia Health, but more on that a little later on. So I want to move on to thinking how we partner to support student success. Parents and families are our partners. As I mentioned, students are at this stage of their undergraduate's career are emerging adults. And so this is kind of that first phase of adult life, which we really recognize. And I'm a parent of teenage and emerging adult in their 20s children. So this resonates really with me as well. And I say this to my children all the time. They are legally adults, yet they're still learning how to adult, right? And so we draw from the work on this, as Arnett's work on this, on emerging adults, and we invite parents and families to be our partners in this work. We know that you as parents and family members are students' first teachers. They've used you to teach them how to get through school and high school and the challenges that have come with being emerging adults. And they're going to turn to you even in their college careers to continue to provide that support and guidance. So we invite you to partner with us to continue that teaching, right? We're all continuing to learn throughout our lives. And at the same time, to recognize that your students are in this emerging phase where they're going to explore what independence looks like, what responsibility looks like. So you need to encourage them how to promote accountability and help to shape and manage their expectations that will foster their success, right? Once they move into college, you're a little more distant. So it's finding that right balance, how to promote that independence, but know that you're still there to support them. You're doing that, and so are we. So I wanted to get very, very specific for a moment in terms of the ways to support, because there is a lot of literature behind this. And it demonstrates that the role parents and families have on influencing behaviors, especially promoting healthier choices and helping moderate influences that might push your student towards less healthy behaviors. So we invite you to offer very gentle yet very consistent reminders to your students around how to make those healthier choices the default and the norm. So talking to them about getting good rest, which can be hard in the college environment when there are a multitude of other offers potentially, right? But how to plan and manage their time really well, how to eat well, how to engage in regular self-care. These areas are fundamental to other activities like learning and can help students. And in fact, their learning will be more successful if these other areas are promoted and supported. So additionally, we consider the timing of our communications. So you think about how those communications that you share with your students can help to moderate their behavior. So I'll give you an example there. If you think about talking to your students about the value of sleep before their midterms, that'll help them to value sleep while they're learning, to reduce procrastination, to promote quality, consistent sleep, right? So it's not just when they're getting to those high pressure times of the year that they're thinking about sleep, but they've been thinking about that throughout the year. Others are thinking about how you're promoting check-ins, right? What conversations are you having with your students about regular check-ins? And what is the timing of those check-ins? So there was one study, this one's pretty interesting, that noted that parents who check in with their students on a Saturday morning actually contributed to the moderation of alcohol consumption among those that choose to consume on both Friday nights, because students know that their parents are going to call in the morning, and also on Saturday nights, because the student's going to remember the conversation they had with their parents that morning. So just thinking about the timing of those check-ins and the expectations that sets with your students may impact them making those healthier choices. Also, I do like to mention that we've done research. Over a quarter of our undergraduate students do not typically consume alcohol at all. So don't have this expectation that alcohol consumption is about 100% mark. In fact, we know 25% of our students do not consume at all. And we've also looked at the data very carefully among students who do choose to consume. Mostly they do consume in a smart, safe and responsible manner. So I share these just as examples, but not to kind of scaremonger that there is what the drinking culture is. Also thinking about friends and their indirect influence again, and those check-ins can help moderate behaviors. There's a bunch of additional ways you can support as well. And this one may be hard. I know this was a learning curve for me as a parent as well, even though I work in this environment. The first is trying not to do things for your students. We've got to work as parents and supports to help and support and guide our students rather than do it for them, because this obviously helps increase the knowledge for students to know how to do things, as well as for them to develop those valuable skills that will help manage future situations. So sometimes trying a bit of a reframe. If your student asks you, what should I do? Instead of just giving the answer of what you should do, because sometimes as parents, we kind of know what that is, maybe responding with, well, what feels right to you? What do you think you should do? What campus resources might help you with this? We'll maybe promote confidence in them in applying the knowledge that they have. They just don't necessarily know how to draw on that knowledge. The university offers deadlines and reminders across many domains, in fact, across all domains. And if a student misses a deadline, and that's the reality of life, it often happens, it happens to us as well as adults, it's a great opportunity to, instead of kind of reprimanding your student on why they missed the deadline, it's an opportunity to explore strategies for the future in terms of how to stay on time and on top of things. You can always ask them to search their email, courseworks, websites, syllabi for deadlines to help them know where to look and plan. But again, you don't want to kind of put all those deadlines in your calendar and then just say, hey, you've got a deadline tomorrow. Did you do X, Y, or Z? Because again, that's not promoting the independence. It never hurts, however, for you to bookmark some of the key university resource websites, and you've been getting a lot of that through all of the communications you've been receiving, because you can then point your student in the right direction if they do seem lost. So what you're doing there is you're teaching them where to find the information. We do the same thing as well in our reminders, but you're not finding them and doing it for them. So again, just some reframing tips for you. I didn't speak specifically to the second bullet point there, but learning to say goodbye, which is hard. And we see this with families on move-in. It's really hard. I've moved 3 kids into college, and it doesn't get any easier. And learning how to say no, which may be different to how it's been when students have been living at home. So we really encourage our families to focus on the help list that's over here on the left side of your screen. Think about the things where you've helped with and how you've supported. You've helped your students with college selection. You're going to help them persist and remain in college, right? That's important in terms of helping your students be successful. Many of you help with some of the financial support, and the help here is the experience they're getting in higher education. But while typically well-meaning, this list on the right under the hinder list can introduce barriers to students and actually limit their growth and development as emerging adults. For example, students will often share with families their plans to be involved in multiple student organizations, that they're going to take more than the recommended number of credits, that they're going to pursue work on campus. And while these are all admirable and actually for many students possible, what we shouldn't do as supports is glorify being busy, right? This is not about just filling every hour in the day. But they're actually helping your student think through how they can space out these opportunities across the academic experience, because we know, they want to have these experiences, and that's very important. But we also want to balance the time for self-care. And certainly for new students, the breadth of incredible opportunities that are going to be offered to them may feel like, oh my gosh, I have to do everything right now. But where you can help is telling your student, you don't have to do everything on day one. You've got years. For many students, you've got 4 years here. You can space these things out. So what are the things that are going to be most important on that first semester? And how are you going to balance it with taking care of yourself? And again, lots of resources around to help your students make that decision, but many ways you can support too. What we list here are basic truths and life skills, and we invite you to be our partners as we promote these concepts with your student. So let me give you an example for the first bullet point here, which is challenging misperceptions. And it's kind of related to what I said earlier. More than a quarter of our undergraduate students, as I shared, choose not to consume any alcohol. Despite our empirical data on this has been consistent for the past 20 years at Columbia. This is not a new trend. There is a misperception amongst our students, amongst all college students, actually, and I think this is linked to movies and TV and social media primarily, but the misperception about alcohol consumption is our students believe all students drink, and all students drink way more than our data shows that they actually drink. So we need to work together, and it's work we do very consistently to promote the true norms. Not everyone drinks. Those who do drink do so in a low-risk manner. So we can really challenge those misperceptions. We can also think about, again, I mentioned this earlier, that responsibility and accountability, setting up those expectations for your students now as you go through the summer and prepare them for coming to Columbia, looking at the resources, knowing how to guide them and refer them, thinking about this truly as life skills training. This isn't just about the academics, knowing about the campus resources. I'm going to get to that momentarily. College is fun. Like, this is meant to be a fun experience. Yes, it can be tough. Yes, it can be stressful, but you can have a good time and you can avoid most consequences. So you don't have to have a negative experience to learn. You can really be proactive in terms of ensuring avoiding negative consequences. So, having said all those pieces about where you can partner and some of the things you can do as you prepare to come, for your students to come, or if students are listening, knowing what your families are thinking about here, I wanted to share more about Columbia Health and what we do. So we're a team of over 200 college health professionals, and we offer programs and services, as you can see here from the graphic, that span medical care, mental health care, health promotion and education, disability accommodations, and violence prevention and advocacy. If you visit our website, health.columbia.edu, you'll find over 80 different programs and services which are designed to support health and well-being for students here at Columbia. And we find that most Columbia students will engage with us at Columbia Health at minimum one point or other during their time at Columbia, but many students engage on a very frequent basis with us, and that's what we're here for. And again, students can connect with us in a variety of ways. Some may be through medical visits, mental health visits, health promotion or violence prevention programs, or using disability accommodations. And in an average year, we complete over 50,000 medical visits. I should say that these services are available to all students at Columbia. So that's not only our undergraduate population, but our graduate and professional schools as well. So we're serving about 28,000 students, but 50,000 plus medical visits. We see over 6,000 students in our mental health visits. And again, both in-person groups and telehealth. We have about 15,000 participants per year in our health promotion, violence prevention trainings and workshops. We facilitate around 30,000 testing, housing, and event accommodations. And this is just a small sample of kind of the scope of what we do, and the ways students engage with us to ensure their health and well-being while pursuing their academic goals. So whatever ways your student chooses to engage with us, and however many times, please know that we are here to help. Healthcare, while at Columbia, is kind of split into these two buckets, on-campus and off-campus care. But there are so many reasons why we encourage students to start their care with Columbia Health. There's no added cost. There are no visit limits. And there's multiple ways students can learn to better care for themselves and their communities because they're engaging, as I've shared earlier, with professionals whose career is within college health and they understand Columbia. All our programs and services evolve as students' needs change. And as I've said, our team is just diverse and expert and truly dedicated to health and well-being concerns of our students. All this work is done both in person and telehealth in all areas of our organization. So we support our students whether they're on or off campus. And what's really special, I would say, about our work is that Columbia Health is embedded in the broader Columbia ecosystem. So we really understand how to connect students to the additional resources that are on campus and then off campus when needed. And this is a big difference than seeking care as students have been used to in a primary care or pediatrician's office, where then, and the same is true if you're to seek that care primarily, that's not going to be embedded in the broader Columbia ecosystem. For many, this is going to be a big change. Students may be used to going directly to their community provider or to a hospital or to an urgent care setting. But as I say, many reasons why it's good. When you see generally an off-campus provider, you're going to pay for every visit, and that's not the case here. As I say, our care is provided. The on-campus Columbia healthcare that you see here is covered by the health and related services fee. All full-time students are required to pay that fee, regardless of what insurance coverage you have. So that's why using that as the primary starting point for care it makes so much sense. And again, no visit limit, and we want to make sure our students are able to access care when we need it. However, we do recognize there may be health needs that are best supported by services that we don't have on campus. So in those moments, our students will need to go off campus. For example, getting prescription medications. We don't have a pharmacy on campus. We have many very close to campus. Needing x-rays, seeing medical specialists and long-term mental health care. This is when students are referred off campus, this is when health insurance covers those costs. And if, by the way, if your student is on our plan, the Columbia University Student Health Insurance Plan, they do need a referral for medical services or counseling and psychological services before seeing an off-campus specialist. But obviously, if they need emergency care in an ER and urgent care, there are no referrals are needed. So you can look at the plan materials for details. If your student is on our Columbia Student Health Insurance Plan, they get monthly emails, which helps students maximizing plan benefits. And if you need any help around insurance, we have a student health insurance team. And you can email us at studentinsurance@columbia.edu to get more guidance on that. I will say regarding off-campus care, we are fortunate to be in New York City, which I think has probably the best medical care arguably in the United States. So in terms of breadth of specialists, access to hospitals, we have a hospital literally across the street. We're very fortunate. And what we know, if we're referring students off campus, we know those networks. So whatever specialist the student needs referring to, we've kind of vetted those out. So the student doesn't need to just go online and kind of guess. We can refer to folks we know and we highly recommend. Okay, there's certain things that your students have deadlines. We've talked about deadlines already, but in terms of health, there are a few things that need to be done proactively. Your student will receive affirmative notification when they achieve compliance with our immunization requirements. And then details on what is needed if they're not yet fully compliant after that initial submission. These immunization requirements are required by New York State. So that's around the MMR and meningitis. The deadline for that is August 1st, 2025, or upon admission, obviously, if admissions are later. We ask our students to submit the health history form before the first day of classes. That lets us understand a little bit more about their background. And certainly if they acknowledge certain health conditions, they will get a reminder of services available to them. We ask everyone to update current mailing address by the first day of classes. And then obviously the insurance plan. It is a hard waiver, which means the default is your student is enrolled in our Columbia Student Health Insurance Plan. If you have comparable insurance that meets our waiver requirements, you can request that waiver. The period to request waivers is now open. So if you do, as I say, have your own insurance, we do find this with undergraduate students often is the case. Make sure your student waives. If they don't waive, they are defaulted into our plan and you will be required to pay for As I shared, we do have immunization compliance, pre-matriculation requirements, measles, mumps, rubella, and the meningitis decision as required by New York State. The two categories of exemption for this are medical or religious. If either of those categories applies, the students must complete the relevant forms and upload the documentation. The deadline for this is August 1st. This is a pre-matriculation requirement. Your student will not be able to register for classes without meeting this requirement. So real reason to get that done. We like to give tips for success so that there's not a lot of backwards and forwards with this. We would like students to be one and done with immunization compliance. So we ask the students to upload their documentations to their patient portal. Please make sure name and date of birth are visible on the documentation. If not, we don't know who it belongs to. If the documentation is not in English, it must be accompanied by a certified translation. We ask you to use our form if able. And for students, please watch your at columbia.edu email for messages from the team. Again, as I mentioned, this must be completed before and compliant before class registration is permitted. There is, as you can imagine, we get about 10,000 of these submissions a year. The team works to get these done as quickly as possible, but we do say there can, at the busiest times, it could take a couple of weeks for the team to fully review. So getting this uploaded ASAP will ensure that your student is able to register for classes. One of the things we do is advancing our community public health, and your students will notice this during the fall. So one area we think about is flu vaccines. This is not a requirement; students are not required, but we strongly encourage our students to get a flu vaccine starting in October. We offer these at no cost, and we make it really, really easy. We do flu fair. Students kind of come with their friends, get their vaccines, get stickers. Sometimes we have prizes. And what it does is it protects the students and it protects the whole Columbia community. Many students live in doubles. You don't want one student getting sick and then passing it on to their roommate. And frankly, when our students do get sick with flu, if we have a bad flu season, they miss class. And usually at the times this is happening is times when the students are busy, class schedules are busy, it gets near finals. So any way to avoid these things should be done. So we really ask our students to take care of you and fight flu, and families, please encourage your students to get their flu vaccines in the fall. As I mentioned earlier, we do use a mandatory enrollment for our card waiver for our health insurance. This is an annual process. We regularly communicate with our students around this. The deadline for this is a little later. It's September 30th, so students do have time to waive. We'll send multiple reminders after a student registers to help ensure that if they want to submit a waiver request, they can do so before the September 30th deadline. Open enrollment process has started on the 15th of July. And if you're thinking about insurance and not sure what the best thing is to do, we encourage you to kind of look at all of our resources. The plan that we offer is a platinum level plan. If you're aware of the different bands of health insurance, platinum is the highest level. It's the highest level of coverage, which means about 90% coverage for most things. It is also a plan that has national and global coverage. So whether you're based in the US or outside of the US, students continue to have coverage, which is really nice. It means for our students who go home during breaks, they can utilize their health insurance coverage when they're away from campus. The premium is billed to the student account. As I say, it's a default billed and will come off if a waiver is approved. Gail, I believe, is posting in the chat how to compare your coverage tool. This is a really helpful tool if you're not sure which is better, your plan if you have one, or our plan. When we've done price comparisons on our plan, we price incredibly competitively. As I say, it's a platinum level plan. It's priced cheaper than the cheapest bronze level plan, which is only 60% coverage. So very competitive pricing, but again, compare both price and benefits using the tool that Gail has shown there. Waiver requests, if you do have coverage, the existing coverage has to meet our Columbia requirements or we will deny that waiver. we have both domestic and international requirements. So we ask you to refer to the waiver eligibility checklist to see if your plan does meet that. And Gail has posted the handy waiver eligibility checklist there. If approved, which meaning it meets all the eligibility, we send the decision to the students directly and the premium will be removed from their student account. If it is denied because it doesn't meet the criteria, the students will be defaulted into our plan. As I mentioned, the open enrollment period has started. It ends September 30th, so that is the deadline. That is a hard deadline. After that date, the student is assumed to be in our plan if a waiver is not received. So how can parents and families support? Oftentimes for our students, this is the first time they're kind of thinking about health insurance. It's been pretty easy. So sit with them, talk it through. If you know that your plan will meet criteria, sit with your students if needed and help them upload their insurance card with the waiver request. And then again, a reminder that this is an annual process. So if you will have to do this every year, this can be a tripping point. Students get multiple emails. They shouldn't ignore it. They shouldn't think just because they did this one year, it's good for their entire time at Columbia. This will need to be done annually. The reason for that is plans change, benefits change. So we verify those benefits every year to ensure the coverage. And just to say, the reason why we are so we're putting so much emphasis on this. Insurance ensures that students can stay in school in many cases. We don't want what would be perceived as a very simple health condition to derail your student's ability to continue in school. I'll give a very simple example. Some plans which don't meet our waiver criteria only cover emergency care in New York. The plan has to cover routine care in New York. The simple example I give is a student falls and breaks their ankle. Sure, their emergency room visit is covered. Putting on the cast is covered with a plan that only has emergency coverage. But if follow-up is not covered and that student needs physical therapy, other follow-up care and supports, the student would have to take a leave of absence because they wouldn't be able to get that care in New York. And that seems kind of wild. Like, you should not take a leave of absence following an ankle injury, right? But with care in New York, they could get all their rehab care and stay in school. So again, the deadline is there September 30th. And as I shared earlier, students who miss the deadlines are not eligible for a full waiver. It would only potentially be a prorated waiver. So please ensure your students don't miss the deadline. So I started with a quote that dated back to Alexander the Great, and I want to end with another quote here. It is not what you do for your children, but what you have taught them to do for themselves that will make them successful human beings. And truly, that is one of the biggest joy of being parents, is watching our children kind of succeed and spread their wings. So we really invite you to help your students continue to learn, grow, and thrive. And with that, I would love to open this up to questions. Gail. And hi, Jill. Welcome back.
Great. Thanks, Melanie. There's a lot. I've flagged a few questions for you to answer, so I'll just push them over to you. And folks, if you've asked some questions, there are answers in the chat. So first question for you, either of you, can we have a health directive on file for our student?
So there's a couple of things to think about here, right? One are advanced directives. Our providers will happily talk to students about advanced directives. And if you go to our website, we have information on that. Often parents ask about having a healthcare proxy on file as well. There are many websites out there that encourage you to do blanket healthcare proxies. I personally don't. I think this goes against much of what we've been talking about, which is around teaching independence for students. Parents say, I want to know everything. I want to know every visit. You actually don't. You want your students to be able to start to manage and engage in their own healthcare without your oversight. Some of the things that they may visit our providers about are not things that you should be knowing about unless they choose to share it. So I don't, while you could put a healthcare proxy in place, it's generally not something I encourage off the bat. Should there be an emergency situation, should students be in the emergency room or admitted to the hospital, the team and the college or sees does contact parents and let them know. So there are, emergency situations where we notify you, of course, anyway. So you've got to kind of think about that balance.
Thank you, Melanie. And then the question is Columbia Health open 24/7?
So we are not. We sleep sometimes as well. We have so in terms of when our services, our in-person services are available, we have pretty extended hours, and you can see those on our website, health.columbia.edu. And we also talk about the website says what's open now. However, we do have access 24/7. So should a student experience a medical emergency at 3:00 in the morning, or a medical emergency, they would probably be calling our CUEMS, our volunteer ambulance, to transfer them to the emergency room. But for example, if it was a question out of hours, calling our number, we do have an after hours service, a nurse response service to get information. Similarly, if there is a mental health emergency, 24/7 availability telephonically when our services are closed. And for any gender-based issue, 24/7 telephone access as well. And that team will respond 24/7 if a student needs accompaniment to a hospital as well. So while the brick and mortar is not open 24/7, access to us is 24/7.
Thank you, Melanie. Next question for you. There are a couple of questions about folks who are unable to submit immunization requirements before or on August 1, and if it was possible to get an extension.
So again, the deadlines are there. The communication with the immunization team is really important. If it just because I'm only getting the vaccine on that date, letting the team know the hold will not be lifted until the requirement is met. So that there's no exceptions to this, but communicating with the team is certainly what I would recommend.
Great, thank you. And then what about being unable to, a lot of immunization questions, their inability to get the MMR vaccine, what in country, and what are their options for getting it when they come to Congress?
Yeah, absolutely. And we understand certain countries have shortages on vaccine. That's why please communicate with the team, and the team will then work with you. We can give the vaccine upon arrival. So please just communicate that with the team. We manage those on a case-by-case basis because we are aware of certain countries where the vaccine is not available. And obviously, then we have to give you the time to get here. We then put a very tight timeline on getting the vaccine when your student arrives here. But we will do that, and we do have the vaccine available here for those students who cannot get it in country.
Thanks, Melanie. And just to say that there is a cost associated for pre-matriculation immunization requirement.
Right.
So this part is not covered by the health fee.
Yeah.
So this is done.
Thank you for that.
Yeah, of course. And then there are a number of questions about specific plans and whether these are eligible. So can you just speak broadly about
the waiver requirements broadly.
The waiver requirements and specific plans.
So this is why we created the Compare My Coverage tool, because that can help. But what I would encourage you to do is look at the waiver criteria and then really understand your plan. So the biggest criteria is the routine, urgent, and emergent care in New York City. This is the biggest one that trips folks up. Many plans that folks have, particularly plans that are state-based, do not have the routine care coverage in New York. So look at that. Look at visit limits. Make sure the plan has no visit limits. If it does have visit limits, that is going to be an automatic denial. Again, we don't want someone to have a plan that says you can only have 20 mental health visits in a year. Someone has a need and 2 visits a week. Those 20 are chewed up pretty quickly. And again, that would lead a student to the situation I described earlier where they're not able to stay in school. So I encourage you to look at the waiver criteria. You can communicate with our team. They're not going to do that comparison for you. They will audit the plan when the waiver request comes in. But Gail, were there specific questions about plan benefits? Again, every plan is individual. I will say Many of the national plans, like the big insurance companies, many of those plans are adequate. So many of those you as families may have through your employer, if they are kind of the big name national ones, will often meet the criteria. It's going to be the smaller ones or the state-based ones that may be problematic.
Thanks, Melanie. And then we have a question about how would it be possible to mid-enroll, like let's say they submitted a waiver successfully, but then something happens mid-semester, could they enroll their student in
Yeah.
the insurance?
Absolutely. So insurance, we understand that the situations change. Employers, jobs may change, benefits may change. That is called a change in life event in the insurance world. And if you lose insurance due to a change in life event, so those kind of circumstances we described, you are then eligible to come onto our plan mid-year, and you would come on at a prorated cost based on when you enrolled in our plan. So should one of those situations happen where you got approved a waiver but then lost that insurance, do not let the student be without insurance. Obviously, that could be devastating. Reach out to our insurance office, and then it's very simple. The paperwork, it would be providing proof of loss of coverage, and then the student could be enrolled in our plan.
Thank you, Melanie. And then we have a couple of questions, I think, that are coming from students who are very specific about caring for themselves. So for students who are athletes or are playing on a sports team, are there any guidance, considerations, things you want them to start thinking about as they come to campus?
Yeah, well, that's great. And so glad students are thinking about their own health and well-being. So whether you're an athlete on one of our teams or you're going to be involved in intramural sports, absolutely. Just making sure you kind of understand how you're going to take care of your health. What are your health needs going to be? The athletes on the Columbia teams have some additional supports. We work very closely with the athletic medicine folks who work with the athletes. So there are sports medicine doctors and athletic trainers. We also have those same athletic trainers come to Columbia Health and provide care to those students who are not student athletes. So we work very closely. So you'll get, the athletes will get a lot of information around that, but they can continue to use our services as well. And similar to other students, and maybe more so for athletes, it's figuring out balance, right? Being a student athlete is a huge commitment. It's a huge time commitment. So thinking through how you're going to balance that with the academic and social commitments, and making sure you've got those resources in place, be it using the professional resources, be that engaging early with someone in counseling and psychological services, if that support would be helpful to you, or maybe thinking about engaging with one of our well-being coaches to think about time management and some of those life skills. So just really trying to think about what those pressures will be, and then reaching out early. And this is true not only for our student athletes, but for all our students. If you even start to feel overwhelmed, think about the resources that are in place. Don't let the things unravel before you reach out for help. Reach out for help early.
Thank you, Melanie. And then, is there anything that students who are legally minors as part of their first year need to know? Are there consent forms that need to be filled out?
Yeah, so it's interesting because there's some confusion around this. If you're minors by age but you're matriculated, you're actually considered emancipated, so it's a little confusing. So if there are forms that need to be filled in, you will be given those forms, but in general, no, there are not additional forms because you're matriculated, so you are kind of considered independent. So you are eligible for all of our services, and we're kind of tracking that, and we do work as we monitor how legislation on this changes or may be changing, and we would then inform any students who fell into that category.
And then sort of a little related then, what is will Columbia Health providers speak with parents if in case of an emergency, if there's no healthcare proxy in place? What is the relationship there?
So generally emergencies that we talk about are when a student winds up in the emergency room or admitted to the hospital. In those cases, Columbia Health providers are not providing the care. However, the school is aware, and the school has an incredible team through parents and family support, and that go out and through case management and well-being, who go and see students. So if a student is in the hospital, the team from the college or engineering will go and see the student, and they will be in touch with the family. In that situation, we're not involved in the care, so we're not going to be the providers who are sharing that care. So in general, families won't speak to Columbia Health providers outside of some mental health emergencies where we will engage with the family through our providers. But in general, the day-to-day medical care, that is not the case. In general, as I say, we're teaching students to kind of independently manage that care and then share with the family. There have been occasions as a provider where students ask for families to be engaged, and that's when we do it. But we will not speak to a family member without a student's express consent. But I do want to reassure you that in the case of hospitalizations or those sorts of emergencies, there's a very good system with the school to ensure that you are aware. So your student's not going to be in the hospital and you're not going to know about it. It's not going to happen.
Actually related, then what is the action for if a student is experiencing a medical emergency on or near campus? What do they do? 911 or?
So generally, we actually, on campus, we encourage our students to call public safety and not 911. The reason is we actually have something called CUEMS, the Columbia University Emergency Medical Service. This is a volunteer ambulance service run by our very own students who are qualified as emergency medical technicians. So they've got the same training as anyone on an ambulance outside of Columbia. And we have 2 ambulances of our own on campus. The advantage of going through public safety is they will dispatch CUEMS who are on campus. That means an ambulance arrives incredibly quickly because they're right here. And our response times for our ambulance is quicker than if you called 911 and requested an ambulance. That's because our students are on campus and they know how to navigate campus, right? The other advantage is it's free. There's no charge. Your insurance plan may have a $150 ambulance copay. You don't get billed any of that if you use our ambulance service. So we actually encourage us to call public safety. That also means the RA or the school will know if the student's happening. And again, it will just expedite all of that communication and care. So that's a medical emergency that needs care right now, like with a transport out of hours. If it was just a question, then you can just dial our number out of hours and we will guide you. Hey, this can wait till this morning. Hey, you should walk to the emergency room, or you should call 911, or we should call public safety, should I say, for EMS to be dispatched. The other thing, living in the dorms, RAs are around. They can also assist, and the residence hall directors are around, and they often assist in case of emergency as well.
Thanks, Melanie. This next question is actually something I don't know the answer to. If there is a medication delivery, does this go through, where should it be delivered? To Columbia Health or to the student's campus address?
In general, it's using your student's campus address, and there's a mail room and that happens. The only differences are some of the specialty pharmacy and infusion medications, and then it's worth speaking with your medical provider. Obviously, if there's things with refrigeration and other things, sometimes making special arrangements. But generally, especially if you're just kind of doing the 90-day mail order supply, you do that to your mailbox and student goes to the mail room and picks it up. So we generally do not accept medication deliveries. As I say, infusions are slightly different. Student is on an infusion, they should engage early with one of our medical providers to make arrangements. And it's also if a student is getting allergy immunotherapy injections, those serums would come to our medical practice.
Great, thank you. And then there are a few questions regarding kind of transitions of, mental health care, medical care. If there are pre-scheduled doctor appointments and they're going to take the health insurance plan, should they just wait till they get to campus? There are a number of questions along that theme.
So it's really a good opportunity to transition a lot of care. I understand, certainly with mental health care, a lot is now available virtually. And so if your student is engaged with a mental health team who can continue seeing them when they're at Columbia and you want to do that, that's fine if you're on your own insurance. Again, if they accept our insurance and your student's transitioning, they would need to have one appointment with our team to get that referral and to continue with that care. Obviously, continuing with virtual care, you need to make sure that the providers can provide care. If you're from outside New York, there are state licensing laws around provision of telehealth care. So sometimes it's not possible, in which case your student would fully need to transition care. If you are taking our insurance, we are your primary care provider, and that's going to be new. So that's something to think about in terms of the insurance decision. And in which case, again, what we don't do is give referrals for primary care on our insurance plan. That the insurance works with the assumption that Columbia Health is your primary care provider. So if that's kind of weighing into the decision on taking the insurance or not, I wanted to share that. And then I really say access services early and before problems arise. So if there's questions on this, schedule an appointment for a check-in with a medical provider. Say, hey, I just want to establish care. So the first time you're meeting your provider is not during an emergency. And that would be a way of establishing care and then determining what pieces need to transition and what don't. We do have web-based appointments. So once student is fully registered, they will be at the same portal that they use to submit their immunization materials is the same portal they could use to schedule appointments. I know we're starting to run late on time.
Yeah, we're starting to come up on time. So I think we'll do another couple of questions. And for those specific questions that we are not able to get to today, we encourage you to reach out to the email addresses that were shared earlier. I can post a number of them before we wrap up over here. But we did have a question around urgent care on campus, and what does that look like? I think it's like a different, you've answered this answered the question a little bit, but I think just if someone needs urgent care, what does a student do?
So if a student has what they perceive as an urgent need and it's when our medical services are open, we encourage students to call. We have a system set up. It's kind of a triage system where the student can say to the person answering the phone, hey, I feel like I've got an urgent need. Can I speak to someone? We then have someone call the student back, usually within the hour, to kind of evaluate them by phone and say, okay, is this something we can see you about today? Or is this something you should go to the emergency room for? And we then do have availability same day to see those students, if needs be, in person or via telehealth. So certainly if it's during the time when we're open, they should try that as the first step because it's on campus and convenient. Again, after hours, I talked about calling. If it doesn't need to go right to the ER, we'll give guidance. There are a number of urgent care practices near campus. So if it's after hours, and the student wants to use urgent care and use their insurance benefits for that, which often is significantly cheaper than going to an emergency room, that is certainly available to our students. And because, as I say, we're in New York City, there's dozens of urgent care practices very easily accessible.
Great, thank you. And I would love for you to answer this question, and I think we can begin wrapping up here. In the event of a sexual assault or any case of gender and power-based violence, are students given guidance around what to do and what the resources are on campus?
Absolutely. It's an unfortunate reality that, that this may happen, but we have tremendous services. We have the only certified rape crisis center on a college campus in New York State. And as I say, that is available, while brick and mortar not available 24/7, access to our advocates 24/7. It is fully confidential. All our services are confidential. So a student who's experienced any gender-based violence can reach out immediately and get guidance, get support, be that accompaniment to law enforcement or to the emergency room, just be it support. And also what our team does is then guide students on reporting and what the other campus resources are around reporting. We can expedite temporary orders of protection if needed. So definitely if a student does unfortunately experience this, reaching out to our sexual violence response team will provide all the guidance and resources, and then the connections, as I say, with the non-confidential reporting resources, should a student wish to follow through with any of that. So, you know, if you forget everything else we've said, if it's anything related to health and well-being, encourage students, we encourage you to reach out to Columbia Health. Parents, remind your students to reach out to Columbia Health. We can then triage and guide and help you navigate what can be a very complex set of systems.
Great. Thanks so much, Melanie. I think that's about wraps up the Q&A. Just before you do your closeout, I have posted the email addresses to contact around student immunization, student health insurance, as well as our general inbox for any inquiries you may have. I will also repost the link to the health insurance webinar that is being hosted next week. This was posted in your emails as well. Representatives from our health insurance team will go over the Columbia Health Plan in more detail and go over the waiver insurance process as well. So for many of you who have specific questions around insurance, highly encourage you to attend that on July 24 at 10 a.m. And I will stop talking now. Thank you.
Thank you, Gail, and I hope we got to many of the questions. You certainly tested me with those, but they're great questions. So we really, truly, as I say here, are grateful for your partnership and support. We're all striving towards the same end, a healthier campus on which our students can live and learn. So thank you for your attention, your participation. I will go to the last slide, that health.columbia.edu is the website with all of this and so much more. We wish you all the best as you transition through this very, very exciting stage. And we are here to support your students when they arrive at Columbia. So with that, I wish you a good rest of the summer, and we look forward to seeing so many of you in September. So thank you so much for your attention. Bye, everyone.